Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look into the muscle reflexes. So the first one is the stretch reflex. So here in the stretch reflex, it is the knee jerk. So the number of synapses, it is monosynaptic. The next one, the stimulus, it's the muscle is stretched. The stretch of the muscle. The afferent fibers, it includes the 1A is afferent fiber. The response is that it is a contraction of the muscle. Then moving on to the Golgi tendon, the reflex and the inverse stretch reflex. So we look at the Golgi tendon, the reflex. Next is the inverse stretch reflex. So this is nothing but the clasp knife. The number of synapses here in the Golgi tendon, the reflex, the inverse stretch reflex is going to be disynaptic. So it is disynaptic and the stimulus is nothing but the muscle contraction is present. So it is disynaptic and it involves a muscle contraction. So what about the afferent fibers? The afferent fibers it involves is nothing but the 1B. So 1A was involved with the stretch reflex, 1B is involved with the disynaptic, that is a Golgi tendon reflex. So the afferent fibers is 1B and the response is the relaxation of muscles. So relaxation of the muscles are seen. Then lastly, looking at the reflex of the flexa withdrawal reflex. So here in flexa withdrawal reflex is after touching a hot stove. This is a flexa withdrawal. So this is nothing but a polysynaptic type. It's polysynaptic type and the stimulus is nothing but pain. So in stretch reflex, it was muscle is stretched, and Golgi tendon, the stimulus was muscle contraction, whereas in flexa withdrawal reflex, the stimulus is going to be pain. So afferent fibers here, since it's polysynaptic, there are many fibers. The afferent fibers, it includes the 2, 3, as well as 4. So all these afferent fibers are present. Now looking at the response. So what is the response? Response, it includes the ipsilateral flexion. Ipsilateral flexion. Then it includes the contralateral extension as well. To learn and grow daily like this, please do subscribe.